with the equipment used on the SenseTech equipment and using the EMDR as the process, how long can it take from a person who's been diagnosed with post-traumatic stress disorder to recovery? Is there a time period that you would like to see it happen using this type of equipment, or is it time, or is it a variant on depending on how poorly the patient is?
Well, it's a very good question, and in some ways it's a simple question that's very difficult to answer. What we know from the research is that for clients that have been traumatized by a single incident, the average therapy time seems to be around 6 to 8 sessions. In some research that compares two different types of therapy, one is known as trauma-focused cognitive behavioural therapy and another is EMDR, the evidence supports the fact that these are both effective, but actually with the EMDR intervention seems to be slightly more efficient than the other approach. So there is data that supports the fact that you're using less therapy time. When we start getting into the realms of more complicated clients, as you mentioned, you're absolutely right. It's a lot more difficult. If we're working with, say, an adult who has experienced multiple traumas as a child, and that person as an adult is quite vulnerable, is quite fragile as an individual, then research tells us that the fact that therapy time is going to be much longer for that individual.